There were huge changes that people didn't really think were going to be permanent, but it seems like they overall are. And there's two different aspects of that. One's on the learning side and education, and the other is also on the clinical care side. So I think both have really improved well to get us into this hybrid stage where you can reach a much larger audience. You don't have to fly somebody out across the world to set them up there for an hour to talk about a topic. You can just really watch the broadcast. And it's helped because in a lot of our education now we get a lot more viewpoints from other people who wouldn't otherwise be there. So it works both ways. It's not just the speaker, it's also the people who ask the questions. So in our educational conferences, we get more diversity and the discussion is just a lot better, much better viewpoints. And the second half of that is that in terms of clinical care, all the tools that we use for digital health have always been there, but now it's just more accepted. And I think that we found a lot of patients would rather, if they have the equipment to do so, because not all do, have telehealth visits where they don't need to drive into either New York City or a train in Los Angeles where it's going to take them 2 or 3 bus rides to get to us. They wait for several hours and then it's a less than 10-minute conversation and the same trip back. So it helps open up access to a lot of people. But still there are certain inequities in that not everyone has the capability to go through telemedicine. Some of them still do have to come and we can't provide that kind of long distance care to them. But overall I think it's definitely a benefit.